everyone, I'm Dr. Doreen, Gastroenterologist in Island Hospital. Today I'll have a short sharing session on common digestive problems, um, and I'll focus mainly on your stomach, as well as the next common organ that gives you problems, such as your large intestine, as you can see here. So, what causes stomach pain? There are many causes of stomach pain. Some may just be from viruses, which may go away in time, but others may be due to some common digestive problems, such as things like gastritis or reflux disease, as well as irritable bowel syndrome. More importantly, we need to differentiate these common, simple, benign problems from the more complicated one, which are things like appendicitis, diverticulosis, and pancreatitis, which may also cause stomach pain. Now, what's gastritis? Gastritis is actually inflammation of the stomach lining. The common causes of gastritis are that due to things like a bacteria called Helicobacter pylori. Um, the gastritis can also be caused from ingestion of things like aspirin or painkillers like Voltaren, um, as well as taking too much alcohol. For some of the common symptoms of gastritis include that of abdominal pain or bloating. Some patients get nausea or vomiting and even bloating. Um, Less commonly are symptoms of loss of appetite and weight loss. These are, as you can see in this cartoon here, these are the usual triggers of gastritis. Ingestion of uh, citrus fruits, sour food, spicy food, coffee and tea. These could be the common triggers of gastritis. The the treatment of gastritis is actually quite simple. Avoidance of these food triggers would be the most important treatment. Secondly, is that if avoiding these foods still do not give you improvement in your symptoms, then your doctor would probably give you some anti-acid medications, some medications to decrease the secretion of acid in your stomach, as well as some antacids. This is the next most common condition that I see in my practice is GERD, in short, which stands for gastroesophageal reflux disease. Um, this is a condition whereby food from your stomach actually move back upwards into this esophagus. Esophagus is actually the food pipe. It connects the stomach to the throat. And so, in usual circumstances in healthy patients, this area is closed. This area actually has a sphincter, a muscle that's closed. However, in this condition, reflux disease, this area is actually loose, and this is a closer view of it. So when it when this area is loose, food can actually go back upwards, or sometimes if this area keeps opening too frequently, food will go up. The symptoms that patients feel are mainly heartburn because the acid goes up and it causes some burning sensation behind the chest. Some patients have some difficulty swallowing or even some dry throat, and some even have symptoms such as um, difficulty swallowing. Yes. Um, some patients do present with chronic cough as a result from GERD, but most commonly the patients usually just present with regurgitation of food or heartburn. Now, these are the common triggers of reflux disease. Um, Eating fatty food, too much fatty food, smoking, obesity, as well as pregnancy can actually worsen patients with reflux. Fortunately, reflux disease is easily managed and controlled. Avoidance of the common food triggers like fatty food, sour food, and spicy food. This can actually improve the symptoms. We also have very effective medications such as anti-acids, which decreases the acid secretion and thereby helping you with your symptoms from reflux. This is another common condition that I see in my practice, very common. It's called irritable bowel syndrome. In short, I'll call it IBS. It's actually a chronic digestive problem of the large intestine. Very common. It affects about 10% of the population. So one in every 10 of us may have IBS. Patients with IBS have symptoms of abdominal pain and discomfort, and it's associated with different bowel movement, either be it constipation or diarrhea, and this discomfort is usually relief after passing motion. The cause of IBS is still unknown. However, we know that in most patients there are usually triggers like an episode of food poisoning or gastrointestinal infection, and so what happens as a result of this infection is that the immune system becomes activated and leading to increased sensitivity of the lining of the intestine. So the usual contractions of your intestine, although the in usual intensity as well as the usual amount of gas, will the patients with IBS will feel it as abdominal bloating or pain. So as I mentioned, these are the common symptoms of IBS: abdominal pain or bloating. Some patients feel very bloated because of excessive gas in the abdomen, and some are troubled by diarrhea, some by constipation, and some by alternating diarrhea and constipation. Ah, so these are the common. I mean, most patients IBS have a common food trigger, be it caffeinated drinks, carbonated drinks, or taking too much ingestion of fatty or sugary food. So we would advise patients with IBS to avoid all this, and lifestyle modification such as regular exercise, drinking plenty of fluids, and distressing methods can actually decrease your IBS. Okay, IBD, although it sounds somewhat similar to IBS, is a more more serious condition. Uh, it comprises of two diseases. One is Crohn's disease, and another is ulcerative colitis. Um, so what happens is that in Crohn's disease, basically your patients develop ulcerations, and they can develop it in any part of the gastrointestinal tract from the mouth all the way to the anus. So these inflamed areas are what causes the disease, and so patients with Crohn's disease will present with diarrhea, and most of the time they have some blood in their stools. As for ulcerative colitis, it's slightly different to Crohn's because it only affects the large intestine, and but patients may also present similarly, such as bloody stools, but more commonly they may also present with weight loss and malnutrition. Um, so while patients with inflammatory bowel disease uh, much they can be sicker compared to patients with IBS, mainly because in IBD there's true inflammation and there's true pathology, whereas in IBS, the although it may trouble patients significantly, there isn't any inflammation or ulceration in the intestine. To diagnose IBD, we have dedicated tests. Your doctor will be performing some blood investigations, some stool tests, as well as colonoscopy and CT scans. Um, Although IBD has no cure, we do have very good medications which can control your symptoms, and therefore controlling the disease. So patients with controlled disease will therefore be able to still lead very normal lives. Um, Next, I'll focus a bit on colorectal cancer, mainly because colorectal cancer is the second most common cancer in Malaysia. It it usually affects older adults, although it can happen to anyone at any age. It usually develops as a small lump. If you can see here, these are what we call as colonic polyps. Um, this usually develop as small lumps, and subsequently it grows bigger and bigger, and then ultimately it may end up as a cancer. Some factors that may increase the risk of polyp formation or cancer formation are things like older age males, low fiber diet, smoking, and sedentary lifestyle. Family history of colon cancer are also one of the very common. It also increases your risk of colon cancer. So this is a cartoon showing colon cancer of how initially polyps develop, and these polyps they actually what we call as pre-malignant, meaning they are not cancerous yet, but with time they may actually grow on to be cancerous. Um, so at, at the stage of a colonic polyp, patients do not have any symptoms. Whereas by the time the polyp develop into cancer, like this growth here, this is a stage 2, 3, and 4, patients will start to develop symptoms. And the symptoms we're talking about are things like rectal bleeding, like passing blood in your stools, having change in bowel motion, like be it constipation or diarrhea, or even sometimes just a change in the consistency of your stools. Some patients may get abdominal pain, some may have just abdominal discomfort, but more worrying is that of unexplained weight loss. By the time the cancer reaches this stage 4, it's a bit too late, and therefore we advise all patients above the 50 to undergo screening, so as to be able for us to catch polyps at this early stage, whereby we can actually do things like what we call as polypectomy, removing these polyps. And if we are able to remove all polyps, then we can prevent any of these from turning into a cancer. So the other test that if patients do not want to go for colonoscopy, the other test that we can also do is that of a stool test. Stool test is actually a test of a stool, and we look for actually blood in the stool. So, however, that test is not conclusive, whereby if we find any blood in your stool, the next step will still be a colonoscopy, and we advise patient to go for it as a follow-up to the positive stool test. As I mentioned just now about colonoscopy is actually a video. There's actually a video camera at the tip of a scope, and how it's done is under sedation. The patient will undergo this procedure, and we'll introduce the scope through your anus into your intestine, and we'll look throughout the whole length of your intestine, looking for all these small little polyps. We cut whichever polyps we see, all of them, and subsequently we will, if you do have polyps before, we will recommend a repeat colonoscopy at a certain time interval. Okay, so now we have I've concluded my session on um, the common conditions that we see in my practice. um, okay, so I've a I've a few questions here. So from Ivan, there's this question on. He says, "Hi, my stomach is always bloated. How do I get rid of the gas in my stomach?" Okay, so commonly, what causes this gas in the stomach and the feeling of this bloatedness is either the type of food that you eat. That's the first thing, and second thing is too much acid production. So what we can do for this, how to get rid of the gas? First of all, is that if you're able to burp, that's one way of getting rid of the gas. The second thing is that if you can't burp out the gas, then and if you're so uncomfortable, your doctor will prescribe you with some medications to get rid of the gas. But ultimately, it all boils down to really your diet and the lifestyle. So if you can take food that does not produce so much gas, therefore you have less gas in your stomach. Okay, the next question I have is from Jocelyn. And this question is the question is that what's the difference between colon cancer stage 2 and stage 3? Okay, so we have many different classifications on how we stage a cancer, and it really depends on what we are. So the common one that I use is this Duke classification, whereby okay, we talk about first stage. First stage is actually the colon the cancer confined to the colon lining. Um, okay, and fourth stage is actually the advanced stage whereby the colon cancer has already spread to other places. Stage 2 and 3 really depends on the local invasion, how much it has invaded into the other areas around the colon. Um, Jocelyn has another question asking, since stage 1 has no symptoms, does it mean there's no way to detect? Uh, that's not entirely true. Okay, so we patients may not have symptoms, but the polyp is already there. So the way to detect this is actually by doing a colonoscopy. So the best test is a colonoscopy, and if we were to go in there, we'll be able to see this cancer. If it's small enough, it can be removed during the scope itself, which is what we call as endoscopic resection, which I can perform. If it's too large, then we will have to advise patients to go for surgery instead. Okay. Um, I've also received other questions prior to this, and I'll address these questions. So one of the question is that how would I know if it's just a normal abdominal pain or something more serious? Okay. My patients commonly ask me this. So if the abdominal pain increases in severity or intensity, and the the interval from one time from the abdominal pain becomes more frequent, like say instead of once every week, now you get it on a regular daily basis, then that's something to be worried about. Also, if you have things like weight loss, if you have blood in your stools, these are the most serious abdominal pain, and therefore you should seek medical attention. And the next question is that what kind of foods should be avoided in trying to control the symptoms of GERD? Okay, so I think most people will love tea and coffee, but these are one of the common culprits for reflux disease. So avoiding coffee and tea, avoiding chocolates, avoiding any of this sourish and spicy food like tom yum would actually be able to control your symptoms of GERD. This is the next question that I received earlier on what complications can GERD lead to down the line. Okay, GERD is actually very common, and most of the time it does not lead to any complications. However, for certain patients, the reflux that goes up and irritate the lower lining of the esophagus, what happens is that this inflammation may lead to ulceration. This ulceration in time, if it's not well treated, it can also lead to what we call a stricturing disease, meaning the ulcers cause the area of the lower esophagus to be narrower. So if it's narrowed, then some patients may have difficulty swallowing food, as in the food will not go down because of the stricture. Another possible complication of GERD is that of Barrett's esophagus. In short, we call it BE. So Barrett's is actually a pre-malignant condition, meaning it's a condition which in time there's a small increased risk of esophageal cancer. So if anyone already has reflux disease which has already caused Barrett's esophagus, we would advise patient to go for regular scopes to make sure that this Barrett's hasn't proceed on to become a cancer. Um, I've got another question from Jocelyn Tan on after surgery and chemotherapy for colon cancer, what is the recurrence rate? Okay, so it really depends on what surgery was performed, what chemotherapy was given, what is the initial stage of the cancer, as well as the grading of the cancer. So cancer, I mean, it's just a simple word cancer, right? But actually, the disease itself is quite complicated. If the initial grading is actually something like what we call a poorly differentiated cancer, then the recurrence rate can be very high despite you removing the whole the cancer. However, if it's a good type of cancer, what we call is a well differentiated. Let's say this cancer is a low stage, let's say a stage 1, which we have removed by surgery. Then chemotherapy may not even be indicated. We only give chemotherapy to patients if we are unable to clear the margins, if the cancer is not a very good type of cancer, if the lymph nodes are affected or the surrounding organs are affected, then chemotherapy is given. So colon cancer is one of the good cancers to have because if we have successfully and adequately cleared, meaning we have surgically removed it and we have given the correct chemotherapy adequately, then the recurrence rate is very low. Okay. Um, this is the next question. If I have chest pain, how can I tell whether is it GERD or is it heart problems? Okay, so heart problems usually more distinct in the sense that usually they don't only get chest pain. Patients can also get breathlessness, and usually this occurs with what we call exertion, meaning when you're exercising, then you get the heart problems. Whereas for GERD, which is due to acid and it's reflux, is usually related to meal times, whether you eat too big a meal, or if you get this chest pain upon lying down, it's because like the food is actually going backwards from your stomach up to your esophagus, or if you get it uh, just after a big buffet, then it's probably related to reflux disease. However, sometimes for some patients, it's very hard to differentiate whether is it GERD or heart problems, and therefore, it's best to seek medical attention, and your doctor, upon taking further history, will be able to advise you on the exact diagnosis. Are there any lifestyle changes I can incorporate to lessen my GERD symptoms? Of course, GERD is very much a lifestyle related disease. And how to lessen the GERD symptoms are if some patients get symptoms worse when they are lying down and especially at night. So what we always advise is that to avoid having your meal times too close to sleeping time. So at least 3 hours between dinner and sleeping time. That's one thing. Second is the sleeping. If you can see here, raising the bed upwards. So some people sleep at about 45 degrees. Increasing exercise may also help lessen your symptoms. And the others are things like non-smoke to decrease smoking and to cut down on the common food which may trigger your reflux symptoms. This is about IBS. Whether does IBS lead to Crohn's disease or ulcerative colitis? No, it doesn't. IBS is basically a chronic condition causing all the bowel symptoms, but in fact, there's no inflammation of the intestines. And Crohn's or ulcerative colitis, on the other hand, is mainly secondary to inflammation. They are two different diseases, although they may sound very similar, they are not the same. So IBS does not lead to Crohn's or ulcerative colitis. Uh, and what tests are used to diagnose IBS and as two other conditions? Okay, so IBS, right? There isn't one test that we can do to diagnose IBS. There is no blood test, stool tests, or scans and scopes and all to diagnose IBS. But usually, your doctors, upon hearing your symptoms and getting more history and risk factors from you, may advise you on tests. And these tests are mainly done to exclude things like infection of the gut. We are also doing tests mainly to exclude IBD, inflammatory bowel disease, as well as to exclude colon cancer because some of these conditions may present similarly. Um, the next question is this: could some other conditions be causing my IBS symptoms? Could I have IBD or colon cancer? Yes, actually, some conditions may present like what sounds like IBS, uh, because they present rather similar. Some can, as I mentioned just now, just abdominal pain or abdominal bloating. So because of this, your doctors will usually recommend colonoscopy to make sure that we have excluded properly. We have made sure that you don't have IBD and make sure that you don't have colon cancer. And if all tests are negative, then we will help you manage your IBS. Okay. Are there any other approaches or treatments for IBS I should know about? So some patients believe in alternative therapies, and although there are things like acupuncture, which may help some patients. The evidence for acupuncture in IBS is actually inconclusive. So, I mean, if you feel that acupuncture helps with your symptoms, then you can go ahead, but make sure to inform your doctors so that certain medications that you take do not interfere with certain alternative therapies that are prescribed to you. Now, who's more likely to develop IBS? Women are more likely to develop IBS, mainly because IBS is a condition whereby is the common stresses are things. I mean, just stress itself can worsen IBS, um, and other anxiety and certain other conditions, psychological conditions also can be correlated with irritable bowel syndrome. Okay, so I have another question here from Stephanie Chan, uh, who says that there are many supplement products which claim to treat IBS, such as probiotics, vitamins, and extracts. And some tend to have clinical studies. Are they reliable? Actually, yes, they are reliable. The studies that are done actually do show that probiotics, but depending on the studies and the strains of probiotics that were used, do actually have effect on patients with IBS. We are not exactly sure what's the mechanism and what's the pathophysiology for for why probiotics can work, but it's mainly along the theories whereby this gut microbiome and how this good bacteria and how good this good strain can actually populate your intestine in patients with IBS and help with the symptoms. So I do believe that probiotic can work, um, given that there are significant number of studies that have proven such. This next question is about colon cancer. Um, no, it's not true that only older men get colon cancer. Anyone at any age can get, although older men are at increased risk for cancer. So therefore, I would urge all patients above the age of 50, be you a male or female, to go for colorectal cancer screening. And why so is because colorectal cancer is I would say the only cancer that can be prevented, um, especially if you were to get screened and have a colonoscopy. Removal of the polyp actually decreases your chance of having a colon cancer. Of course, you should also have good health, maintain live a healthy life, such as stop smoking, watch your weight, eat in moderation, and stay active by performing regular exercise. Okay, what screening test would you recommend? Um, and do I need to get a screening test for colorectal cancer? So if you're 50 and above, yes, you need a screening test. And what would I recommend? So the the best test for colon cancer is actually a colonoscopy. Whereas if patients are worried or they have increased risk of I mean, they have other comorbidities, meaning they have other conditions, and they are afraid to go for colonoscopy. Having a going for a stool test, which looks for blood in the stool, is better than not getting any test done at all. Um, yeah. um, this next question is about colonoscopy and whether is it uncomfortable or can it be painful. So the procedure is usually done under sedation, and it's usually not uncomfortable and not painful in a patient who is adequately sedated. Um, some patients, however, they may feel some discomfort because of the distension of the intestine during scope. It's part of the procedure whereby when we do the scope, we're actually blowing a lot of gas into the intestine, and therefore, some who are more sensitive to this gas, they may feel the discomfort of the air. Okay, and how often should someone go for scopes? Okay, so this really depends on the risk, your risk of colon cancer, whether you have any family members with cancer yourself, whether you have any previous colonoscopy and any previous polyps. Um, and the quality of the bowel preparation. So if you had done a colonoscopy but the preparation was poor, meaning when we went in there was a lot of stools inside, therefore you should go for the next scope at an earlier time. If everything was done well and correct, then following a normal colonoscopy, 10 years later is when you should get the next scope. But if you do have a family history of colon cancer, then your doctor will advise you to go for a 5 yearly scopes, starting the age of 45. Okay. Okay. That's the end of our Q&A session. Okay, there's another question from Jocelyn. Is CEA a good enough test to monitor, assuming no symptoms, thus no need for colonoscopy? No. CEA is not a test to look for cancer. CA is mainly used in patients who already have been diagnosed with cancer. So if you already have cancer, then we use CA to monitor the response to treatment, whether following the surgery, whether has it gone up, or whether following chemotherapy is it going down or not. So we shouldn't be using CEA to diagnose or to look for colon cancer. Okay, so we've come to the end of this short sharing session, and I hope the questions and answers I mean, you have managed to gain something from this, and yeah, do seek your doctor's advice if you have any of these symptoms, if they are persistent and not improving with the simple measures that you have taken, um, to look for us. Okay, so thank you. Bye.